Nitheesha, Dr. Nitheesha. She's here. Dr. Pradosh, be ready. I don't see any Pradosh. Nitheesha is here.
Good evening, everyone. Ophthalmomyiasis externa refers to the involvement of superficial external ocular structures, commonly by fly larvae. The clinical presentation of this parasitic ocular infection ranges from mild conjunctival irritation to more severe conditions involving the retina, which can result in permanent vision loss, highlighting the need for early diagnosis and treatment. It is usually observed in rural areas. Our patient is 60-year-old male and presented to our OPD with the complaints of severe burning, pricking sensation, watering and redness in the right eye. And patient is a shepherd by occupation. He had foreign body sensation in the right eye initially, followed by above mentioned symptoms since 2 days. This is the first right eye picture showing mild upper and lower lid edema and congestion. And visual acuity in both the eyes is 612 unaided, and it's improving to 6.9 with pinhole. And on slit lamp examination, pupils of both eyes are round, regular, reactive to light. Anterior chamber is normal in depth and quiet, and lens is transparent. As you can see, this is the right eye, where you can see a 1 to 2 mm translucent structure, motile with a dark head. The treatment we given is, first we have applied topical anesthesia, 0.5% proparacaine, then maggots were removed from right eye with the forceps and cotton swab, and eye wash was given with normal saline, and maggots were collected in a sterile container and was sent to the parasitology section. As these are photophobic, we couldn't remove all the worms in a single sitting, so we told the patient to close his eyes for 10 minutes and then remove the worms again. Treatment received is, after removal of worms, we have given moxifloxacin 0.5% 4 times per day for 1 week, and lubricating eye ointment CMC 0.5% 4 times per day for 1 week, and olopatadine eye drops 0.1% 2 times per day. And microscopic examination, it revealed about 1 to 2 mm length worms displaying 4 rows of spines, and at the cephalic segment had 2 large black buccal hooks. And the features were consistent with the morphological description of first larval stage of Estrus ovis larvae in the literature. Discussion: myiasis is the infestation of living or decaying tissue in the humans of animals by fly larvae. Ophthalmomyiasis specifically refers to the presence of larvae in the eye. And externa involves the infestation of external ocular structures, including the conjunctiva and cornea. And ophthalmomyiasis interna refers to the penetration of larvae into the inner structures of the eye. The female Estrus ovis retains her eggs within her body until they hatch, after which she typically deposits the larvae into the nostrils of sheep and goat. When these larvae infest the human eye, the infection is usually limited to the conjunctiva and cornea. It primarily affects shepherds and farmers in rural areas, and has also been reported in urban settings and in individuals with no direct animal contact. Other identified risk factors include pre-existing eye infections, ocular wounds, advanced age, weakened health, and poor nutrition. So the management will be prompt identification of the maggots and the removal, and topical antibiotics, antihistamines, and lubricants, and hygiene to prevent the infection. Ivermectin can be given in refractory cases and as prophylaxis. Conclusion: myiasis is the infestation rather than infection of tissues, including organs in humans or animals by fly larvae, primarily from the families of Estridae, Calliphoridae, and Sarcophagidae. These larvae are commonly referred to as maggots. The most frequently reported cause of myiasis is Estrus ovis, that is the sheep nasal board fly. Detailed history is important for management. Removal of the larvae may be difficult due to their strong attachment to the tissue, using their oral hooks and body spicules. Prompt and aggressive treatment coupled with regular follow-up care is essential for effectively managing the disease and slowing its progression. These are my references. Thank you.
So any other treatment has been reported, like some castor oil reports?
No steroids, ma'am, but
Not
ivermectin.
castor oil, not steroid.
Castor oil. No, but I have seen ivermectin they have given, ma'am. But that is also 1% ivermectin solution is given just to wash the surface with povidone 6%. But other than that, uh, nothing was
Nothing.
there, ma'am.
And what about the hygiene of the patient as such, the hands
Yes, ma'am.
and the hair? So, they must be infestated other places also, the
Yes,
nail
ma'am.
beds, the hair of the patient. So
Yes,
the
ma'am. Hygiene
lashes.
should be maintained, and after they come in contact with sheep or the animals they are in contact with, they should wash their hands and all. That should be explained to the patient. And the larvae are found on the stagnant water also.
Yes.
So if they wash the face with that water, it will happen. So we have to instruct the patients to prevent further attacks.
So in this patient, you could remove all the larvae because.
Yes, ma'am. We have retrieved 3 larvae first, but the worms are photophobic. So under slit lamp biomicroscopy, if the light is thrown, they'll go and burrow into the corneal fornices. So we'll tell them to shut the eyes, and then again we'll see they'll come onto the surface, and we'll remove with fine forceps, non-toothed.
Interesting. Thank you.
Thank you, ma'am.